Good morning. Thank you so much for the opportunity. And since yesterday we have been hearing about some environmental toxins, and this morning we heard about viruses. And today I would like to introduce you sugar with a different perspective, and I would like to ask you whether sugar is one of the environmental toxins that we have been exposed. I have no disclosures, and I will ask Erin's help. I would like to share you what we know about sugar back in 1970s.
Now, as you know, there are reports citing possible links between sugar and heart disease, diabetes, obesity, tooth decay, hypertension.
Yes.
All the diseases that are epidemic in the population. Now, sugar alone, I know, is not responsible for any of these diseases, but certainly the risks associated with a high consumption of sugar are demonstrably large.
I'd have to disagree. The risks associated with a high consumption of calories are demonstrably large, but not with sugar.
Now,
and another one about sugar and what we know today.
Could eating a lot of sugar actually cause my diabetes?
Eating a lot of sugar definitely does not cause diabetes if you don't eat so much sugar that you gain weight. And in fact, sugar to a certain extent is okay because it stimulates the pancreas to make more insulin, which actually helps control the blood sugar. And so actually you need a certain amount of carbohydrate in your diet to have your pancreas working normally. What I always tell people is that, especially if you're at risk for diabetes, you know, I have people tell me all the time that, I've got a family history of diabetes, so I watch how much sugar I eat. And I say that that's not the right focus. The focus for you should be to make sure you keep your weight down. Because people who have a family history of diabetes, if they stay thin, have no more risk of diabetes than the general population. But if they become overweight, then their risk is 10 times higher than in the general population. So you can make a difference of 10-fold in your risk of diabetes if you've got a family history. If you stay thin, it's good. If you gain weight, it's bad.
Thank you, Erin. And this is a quote from Coca-Cola Company's Coming Together company back in 2013. And they say that all calories count no matter where they come from, including Coca-Cola and everything else with calories. So as the common sense, the obesity is calories is a problem that develops from calories in and calories out. And if you are exceeding your daily intake, then you end up being fat. But science has something else to say, and according to science, some calories cause more disease more than others, and different calories are metabolized differently. So a calorie is not a calorie. For example, if you consume a cup of almonds with 160 calories, you end up absorbing only 130 because of the fiber. You are not able to absorb all the calories you consumed. And if you are consuming protein, in order to utilize the amino acids, you need to burn some ATP. So you have to consume some energy in order to gain energy. And there are trans fats and omega-3 fats, which are good fats and bad fats, but they are all 9 calories. All a gram of fat counts as 9 kilocalories. So a calorie is not a calorie. And also there's fructose. So here is the high fructose corn sugar is composed of about 55% of fructose, and sucrose is half fructose and half glucose. So here is the glucose 6-member ring, and this is fructose 5-member ring, and sucrose composed of a glucose and a fructose molecule. I would like to remind the definition of toxicity here. So a substance is called toxic to a degree which a substance can damage an organism. But in this definition, there is not a distinguish between acute or chronic toxicity. And in order to define fructose as a toxic substance for our body, it must be an independent risk factor, exclusive of its calories and exclusive of obesity, and it must establish a causation. So you can argue that most of the fructose toxicity studies are animal models, and in which animals are administered excessive amount of fructose. So I will be talking about human data, human consumption, and in doses routinely ingested. Is obesity the problem? I think obesity is not the problem, because people do not die of obesity, but they die of metabolic syndrome, components of metabolic syndrome, particularly diabetes. And diabetes is the disease which we have been spending a lot of money on. And here is an exclusive view of obesity. And 30% of adult population in the United States are obese, and 70% are normal weight. And 80% of 30% obese population is sick. They have type 2 diabetes, they have cardiovascular disease, they have hypertension, dyslipidemia, and they have all these components of metabolic syndrome because they exceeded their daily intake and they became fat. However, 40% of the 70% normal weight population has the same disease. They are suffering from type 2 diabetes, hyperlipidemia, and hypertension. Slightly lower prevalences, but they still have, they are still metabolically unhealthy. And when we look at the total, almost half of the US population is metabolically unhealthy. So it looks like there's an exposure which affects the population. Here you can see the daily sugar consumption gram per day over 200 years. And this is the growth of sugar in this industry. This is period of stabilization, World War II, and advent of high fructose corn sugar and its replacement for fat. And these are the thresholds. The first one is the threshold defined by American Heart Association for cardiovascular disease, and this is the theoretical threshold based on alcohol, because alcohol and sugar are metabolized in the same way when they enter the mitochondria. We glycolyze the glucose, and yeast glycolyze the ethanol, and then when they enter the mitochondria as acetyl-CoA, mitochondria doesn't care where the substrate came from, it utilizes the substrate in the same way. And here is the very first time we pay attention that there's an increase in the diabetes prevalence in New York City, and this is the emergence of cardiovascular disease as health issue in 1931. And this is the time when we realized that adolescents are getting type 2 diabetes. So there's not a correlation, there's not a causation, but there's a relationship between the sugar consumption, increasing amount of sugar consumption, and the development of metabolic problems. So the relationship between sugar and diabetes are confounded by obesity. Here is, you can see the prevalence of obesity and prevalence of diabetes in the world. And this is the correlation line. And there's a strong correlation between, you can say that there's a correlation between obesity prevalence and diabetes worlds. However, there are some countries which are not obese, but they are not, they don't have the higher prevalence of diabetes, which are Mongolia and Iceland. And there are also some countries which are not obese, but they have high prevalence of obesity, like Pakistan, Afghanistan, Bangladesh. So diabetes and obesity are not concordant. Diabetes is not a subset of obesity, because obesity is increasing worldwide 1% per year. However, diabetes is increasing in a much more higher rate in the world. If they should be increasing in the same rate if the diabetes is a subset of obesity. In this relationship, we need to look at the plausibility. So this is your nice and pink healthy liver tissue. It's nice and pink and normal. And this is the fatty liver disease. You can see the distorted sinusoids, the lipid accumulation, and infiltration of macrophage here. And is it alcohol or is it sugar which causes the fatty liver disease? It's hard to say because exactly they say they look like same in the histologic preparation, alcoholic fatty liver disease or the non-alcoholic fatty liver disease. Non-alcoholic fatty liver disease has become an epidemic, and right now 1/4 of the African Americans and almost half of the Latinos are do have steatosis, and 5.5% of adult population in the United States are suffering from non-alcoholic steatohepatitis. And in children, when you look at the autopsy specimens who died from causes other than metabolic problems, aging between 5 to 19, you can see steatohepatitis in 13%. And if those kids are obese, when you look at the obese group, this rate increased to 38%. There are 3 kinds of fats: the visceral fat, the subcutaneous fat, and the liver fat. We know that the visceral fat is not good. But here is an obese person with a lower liver fat accumulation in the you can see it in the MRI scan. And this is an obese person which has a higher liver fat content, and this patient is sick than this patient. And there's a thin person who has a high liver fat in the MR fraction, and those 2 patients are as sick as the thin one is as sick as the obese one. So in this study, which is done in Korean adults, show that there is a non-alcoholic fatty liver disease is the primary predictor of type 2 diabetes. You can see that with the quartiles and adjusted odds ratios, and they controlled in their models. They controlled for BMI and energy intake. And in this study, they try to explain the change in insulin dynamics with the intrahepatic fat accumulation and the visceral fat. And when they hold the intrahepatic fat in their models, when they hold the intrahepatic fat constant and try to explain the changes with the visceral fat, they couldn't see any difference between low and high visceral fat. But when they do the reverse and hold the visceral fat content constant and try to explain the change in insulin dynamics with the intrahepatic fat accumulation, they see that the higher intrahepatic fat you have a more insulin resistant. And what is the mechanism between sugar and diabetes? So the first problem is fructose is not the glucose. Glucose is essential for every single cell in our body, but we synthesize fructose if it's necessary. And the common wisdom is a calorie is a calorie and sugar is just the empty calories. But chronic fructose exposure promotes liver fat accumulation, and this promotes the metabolic syndrome, and also increased protein with the chronic fructose exposure increases your protein glycation, which promotes cellular and structural aging. Here is the fate of glucose when you consume it, and only the 20% of the glucose enters the liver cell. The rest of the glucose is consumed by your body, your muscles. Glucose enters the body, and again, most of this glucose goes into this neogenesis and stored as glycogen. And a very small amount of it enters the mitochondria to the TCA cycle and generates ATP. Very little amount leaves the mitochondria via citrate shuttle and contributes to the de novo lipogenesis. And you export the newly synthesized lipids as triglycerides out of your liver. And when we look at the ethanol, 80% of the ethanol you consumed enters the liver cell. And here you don't see any glycogen in the picture because all of the ethanol that enters the liver cell goes into the mitochondria and overwhelms the mitochondria, exceeds the TCA cycles capacity and leaves the mitochondria as citrate. And again, this citrate contributes to de novo lipogenesis. And you export triglycerides. That's why you have hypertriglyceridemia in alcoholism. And you also store the newly synthesized lipids in your liver cell. And now let's look at the fructose. Fructose enters the liver cell. There's no contribution of glycogen synthesis in the metabolism of fructose in liver. And fructose again enters the mitochondria the same way alcohol did. Again, overwhelms the mitochondria. Citrate exceeds and contributes to the de novo lipogenesis. So you export triglycerides and you store lipid in your liver. So that's why alcohol and fructose are metabolized in the same way. This is a study from Jean-Marc Schwartz at San Francisco General Hospital, and this is a crossover study where normal weight adults are enrolled, and they were studied to determine their liver fat amount on isocaloric fructose diet versus complex carbohydrate diet. And they held the daily calorie intake same. So it's the same number of calories, but just the source of the calories are different. And they showed that the amount of lipid you store in your liver increases 27% on the same number of calories if you are consuming fructose. And we also recently concluded a very similar study in African American and Latino obese Latino adolescents, and our results are also in line with this study. And Jean-Marc Schwartz will be presenting the data from our study in Endocrine Society meeting later this week. So I'm mentioning it, but I can't show the results. So the second problem with the fructose is the browning. So all the common thing in this, the common thing with all these pictures are they're all brown. So they are all results of a browning reaction, Maillard reaction, or non-enzymatic glycation. We do it every day, and this is to show you the aging in the costal cartilage. So as you age, you are getting getting brown. And during this browning reaction, non-enzymatic glycation, you're generating reactive oxygen species. You generate through glycolysis, fructose generates it, and you have your reactive oxygen species every day. This is the glucose. This is the linear form. This is the ring form. You only have one carboxy group that's active, and in your normal body temperature, during your normal daily life in normal body temperature, 99.2% of the glucose is in the ring form, preventing that reactive hydroxyl group from glycation. However, the fructose has two reactive carboxy groups, which are more prone to glycation, and in normal body temperature, only the 97% of the fructose is in the ring formation. And unfortunately, the glycation rate of fructose is higher than glucose. and it happens 7 times faster than glucose. When you put albumin in a test tube and add glucose and fructose in it, and you wait and you watch how the change of glycation happens, and you measure it every day with spectrometry, you can see that the rate is 7 times higher in fructose. So let's look at the human correlation. In this study, they look at the consumption of sugar and sweet beverages and relationship of the diabetes. It's a study from Europe, EPIC Interact study, and they adjusted their models for energy intake and BMI. And they showed that every single can of sugar and sweet beverages you consume, your risk of getting diabetes increases 29%. So what about causation? In this study, they collected data from Food and Agriculture Organization about how the total calories, fruits, oil consumption, the sugar consumption, and the roots, pulses, nuts, and meat and cereal consumption. And they included their data set, the diabetes information worldwide through International Diabetes Federation. And the World Bank, they used the econometric data from World Bank World Development Indicators database. And the data showed that the diabetes prevalence rose from 5.5% to 7% over the last decade. And their effect models show that overall there's an effect. And here is the change in sugar availability and the change in diabetes prevalence, and you can see that there's a correlation here. The only change in sugar in the study, the only change in sugar availability predicted the change in diabetes prevalence, and every extra 150 calories consumed increased the diabetes prevalence by 0.1%. However, if those extra 150 calories are coming from a can of soda, then the diabetes prevalence increased 11-fold. And this is a big increase compared to other results they find. And with this study, we can say that increased dose of fructose consumption, there's an increase in diabetes prevalence. And we can talk about the duration of exposure and the development of diabetes. And we can talk about the directionality. And also, we can talk about the precedence, because whenever the availability in sugar changed in a country, 3 years later, the diabetes prevalence increased in the same country. So we can talk about the precedence. And this shows us there's a medical causal inference here. And this is the same criteria that they showed there's a relationship between tobacco consumption and development of lung cancer. So, if we look at the fructose enters your cell, it goes to your mitochondria, overwhelms it, you generate reactive oxygen species, you synthesize lipid droplets, you accumulate here. Excess reactive oxygen specimens overwhelms your peroxisomes, your endoplasmic reticulum, and you end up with cellular aging and your unfolded protein reaction or endoplasmic reticulum stress. So epidemiologic data shows that associations between added sugar and chronic metabolic disease, exclusive of calories and obesity, and econometric data shows that there's causal medical inference for added sugar and diabetes. And the interventional isocaloric glucose for fructose data show improvements in metabolically healthy ectopic fat and metabolic health, even with no change in subcutaneous fat or weight. And so as a conclusion, our view of the role of diet in disease needs to be changed. Thank you.
We do have a few minutes for questions for clarification. A couple of questions in the audience.
Thank you. Very nice talk. I guess one of the questions I would have is any ideas of what the fructose, for example, might be doing the microbiome. I mean, you focused on the idea of the parallel to ethanol and overwhelming mitochondria, and we've heard at this meeting a lot about reactive oxygen and so on. But what about alterations in the microbiome?
So, what the conclusion I can make from the previous presenter and your question is, and what I know, I think it can, fructose can also be toxic to microbiome, or alteration of the microbiome might lead to a more excessive amount of absorption in fructose, so they can be influencing their effect in development of obesity in both ways.
Okay, next question.
Yes, I wanted to ask how you differentiate in these studies between other things that have also changed. For example, the plasticizers in the sodas that are correlating. And we've heard a bit about that. So many things have changed simultaneously. Attributing causation to one of them and eliminating all of the others it worries me a little bit. So I would like to know how do you think about that?
So it's a good point, and I don't think that there has what I read from the paper that they didn't consider changing changing the environment and how they how the environmental exposure has changed over time. But in the last study, they controlled for aging, urbanization, physical activity, income, and rurality. So these are the factors they controlled in their models. But of course, with the changing environment, you are right. That's a good point.
So we have a question from the webinar participants.
Right, and actually it's from one of the speakers, from Nick Durander. So he asks, you talked about the role of sugar in diabetes and related metabolism. Do you have any thoughts about its role in obesity?
So I think obesity. Obesity is one of the. Obesity is one of the. It's not the main problem. It comes with the package. So you deal with diabetes, you deal with metabolic syndrome, and obesity is tagged along with those problems. So being metabolically healthy or unhealthy is the problem.
Okay, thank you very much. One more question. You could come to the mic, or they'll bring a mic to you.
Sally Darney, EPA. What about wine? It's high in sugar, and red wine has antioxidants, and it's got alcohol, and there seems to be an increase. Has anyone have consumption with burgeoning vineyards all over the place? So has anyone looked at that?
It's a good question. I should look and read more about it.
All right, thank you. Okay, thank you so much for a wonderful
Thank you.
presentation.